So this is a demonstration of a lumbar thrust manipulation technique. It has a couple of different names. Traditionally, it was called the Chicago roll manipulation. It's also just called a non-specific general lumbar rotation manipulation. This is the technique that was taught in the clinical prediction rule for lumbar manipulation, where if you meet the clinical prediction rule guidelines, this is the technique that was used in the research article for that cluster. So to set the technique up, the patient starts in supine. The first thing that you're going to do is side bend the patient by moving their hips towards the clinician. So the hips are going to move like this, and you want them to, so what you're essentially doing is you're trying to lock out the spine above the lower lumbar. And so you want to make sure that you're maximally side bent. So you're also going to cross the legs, and you can side bend further by just bringing the legs over. And I can also take the upper body and just side bend it a little further. So it should be feeling maybe some tightness on this side here if you're reaching that end range position. Now from here, the patient will put their hands interlacing their fingers behind the head. And this is kind of the tricky part in the setup. So you are now going to rotate the patient towards you while you try to maintain this side bent position. So it's very easy when you start to rotate. If I just rotate, sometimes it's easy to lose a lot of your side bend. So in order to account for that, what I'll do is arms come together so the elbows are pointing up to the ceiling. I'm going to put a fist down here just to monitor how much side bending, just to make sure that side bending stays there. As I rotate the patient towards me, or the other way you can do it is kind of scoop. So I can scoop like this to start the rotation. Then put a hand down here. I'm going to take my other arm and thread it through the forearm like this. And now I have my fist, I have my right fist pinned down in front of the shoulder that's on the bottom. So her left shoulder. My fist is pinned right in front of that shoulder so I can stop her from losing the side bend. Now I'm going to, as I rotate, I'm looking for the hips to start to come off of the table. This hand is going to be on the ASIS, and as I start to feel the hip come up off the table, that's when I know I've got things wound up, and I'm going to start applying a force posteriorly. So I've got things wound up here, and this is when you apply the thrust.